Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Onwoka. First, the highlights. A coronavirus bill prescribing punitive measures for defaulters of the preventive protocol signed into law in Lagos. Rivers roll out vaccination across the state after receiving 150,000 doses of Oxford AstraZeneca. And European Union medicines regulator reiterates that there is no indication the Oxford AstraZeneca vaccine causes blood clots. The Nigeria Center for Disease Control (NCDC) has discharged 353 people after treatment from various isolation centers and home care across the country. This brings the total number of those discharged to 145,752. The agency says some of the discharges today include 120 community recoveries registered in Lagos and 34 in the FCT managed in line with its guidelines. In an update published by the center, 238 new infections have also been confirmed in 17 states. Lagos had the highest figure from last night with 72 new cases, followed by Kwara and Bauchi with 28 and 19 infections respectively. Kaduna State also recorded 19 new cases out of 132 analyzed in the state. The local government areas there with new cases include Igabi, which recorded 4, Lere 4 as well. Kaduna South recorded 3 new cases, Kaduna North 2, Ikara 2, Kajiru 2, Chicken 1 and Soba 1. In Kaduna, 23 patients are also due for discharge, while other states that have recorded new cases are Edo, Ogun, Nasarawa, Rivers, Ondo, Akwa Ibom, Gombe, Niger, Osun Plateau, Oyo, Kano and the FCT. The latest daily figure is higher than the 120 cases reported in the previous 24-hour cycle. That's the lowest figure this year, raising the total number to over 160,000. However, 3 fatalities were recorded last night, increasing the death toll to 2,016. The NCDC reports that the country has also tested over 1.6 million people. Now to some other stories now. The Director General of the World Trade Organization, Dr. Okonjo-Iweala, is continuing her visit to heads of agencies in the Nigerian government. During a conversation today with the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, the WTO DG promised to continue her push for availability of vaccines for poorer countries, insisting that's the only way the world will be free of COVID-19. And now, the President of Senate, Ahmed Lawan, has taken the lead at the National Assembly when he received the first jab of Oxford AstraZeneca vaccine. The vaccine was administered in his office by his personal physician, Dr. Mohammed Usman, and witnessed by some distinguished senators, led by the Senate leader, Senator Yahya Abdullahi. The vaccination card was presented to the President of Senate by the Chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe. Speaking shortly after he received the first jab of the vaccine, he called on Nigerians to make themselves available for the vaccination. Over in Lagos, the state governor, Babajide Sanwo-Olu, has signed 4 bills, including the State Procurement Bill of 2021 and the Coronavirus Pandemic Emergency Law of 2021. Governor Sanwo-Olu assented to the bills at the swearing-in of newly appointed members of the State's Public Procurement Agency Governing Board and 2 permanent secretaries at the State House, Ikeja. The State Attorney General and the Commissioner for Justice, Moyosore Onigbanjo, explains that the COVID-19 law allows the state government to fine or sentence offenders to jail.
The governor has just given his assent to 4 bills passed into law by the State House of Assembly. The COVID-19, the coronavirus pandemic law 2021 essentially formalizes the structures already in existence in the state for managing COVID-19. It appoints the governor as the chairman of the committee. Also in that committee is the Commissioner for Health. It has also made a provision of 20 billion naira available in the budget for fighting the pandemic. It has also set out all the penalties for people who fail to wear masks in public, people who fail to observe COVID-19 social distancing regulations. It gives the courts powers to fine, and in certain cases to even imprison violators of the law. So with that law, we will use that law to strengthen the state's fight against the spread of the pandemic in Lagos State. Fines are in the law, and it gives the courts the discretion to either issue a fine or sentence you to jail or to both. Well, it depends on the offense. There are various offenses. 1 year in jail. The extreme, I think, is about 2 years in jail, depending on the gravity of the offense.
Staying in Lagos State, as more concerns grow over the possible side effect of the COVID-19 vaccine, the Lagos State Commissioner for Health, Professor Akin Abayomi, says reactions to the vaccines are normal. He explains that everyone reacts to vaccines differently and there is nothing to worry about, adding that those with adverse effects means their body system is reacting to one of the antibiotics and the state government is ready to manage such cases.
On Saturday, I felt a little bit bone pains, a bit cold. Of course, the injection site was a bit sore. So I just took some Panadols. I went to sleep. I did a bit of exercise, and then I went to sleep. And I woke up yesterday morning, and I felt fantastic, But, everybody is different. We expect that some people won't feel anything at all. Some people have a bit of body pain. Some may even have shivering. Those are all expected side effects. It's in the literature. We mentioned it. And we just categorize those as adverse events following immunization. There's another category called adverse events of special interest. And those are very rare. So the first type of getting pain at the site of injection or feeling body pains or headache is normal. Most people will experience something like that if you take the vaccine. But the one special interest, they're serious. They cause people to collapse, they go into shock, they get severe complications from, and it can happen with any vaccination. It's not confined to COVID.
Mrs. Margaret Ayorinde joins us on the program. She has consistently made meaningful contributions to the field of nursing across West Africa. She's worked in countries including Liberia, Sierra Leone and Guinea, has played an important role in helping to treat and stop the spread of diseases including COVID-19, Lassa fever and Ebola. Mrs. Ayorinde is a certified infection prevention and control nurse from UCH Ibadan, also a member of the Nigeria Center for Disease Control, and has been working on the COVID-19 response team of Lagos Epicenter as a responder for the Africa Center for Disease Control. We'd like to thank you for joining us on the program.
Thank you, Mr. Sen, for inviting me to the program.
All right. Briefly tell us about the work that you do for the Africa Center for Disease Control.
Presently, I'm an infection prevention control nurse, and I'm being engaged as infection prevention control expert for Africa Center for Disease Control. Presently, I'm on the COVID response team. We go about our major job. It's surveillance, contact tracing, case management, and then training and retraining of healthcare workers, and making sure that all the deliverables from the NCDC PPE, what we used to work, is available, and the healthcare workers' welfare is taken care of.
So how would you assess the past year for COVID-19? I mean, the COVID-19 protection and the prevention measures, some of the things that you've experienced.
Since inception in Lagos, and when I've been invited to be a volunteer April 1st, 2020. Yes, it has been burdensome. And the burden of COVID-19, it's new to us, it's novel. At the time, we were not really having healthcare worker volunteering, but at point in time, people started coming out to survey the situation. What I would say is that Nigerians are really good caretakers and they love to serve humanity.
In terms of perhaps some of the challenges you experience, because you've said you've conducted some training on infection prevention and control. You know, if you remember at the beginning, PPEs, the donning and doffing, it appears some people had problems with that. What would you say is some of the major challenges that you had while teaching the IPC measures?
Yeah, what we gathered is that we are forgetting about our hours. We lower our guard since Nigeria has been declared free from Ebola in the year 2014. Training has been stepped down. It has not been really going on, and it's supposed to have been training and retraining, people going on and doffing as a summer station, which we don't really have, and then that caused a little bit of a challenge during the session of the training, and for people, the healthcare workers, volunteer to come up. But as time goes by, within 21 days, people were able to gather themselves together, and for the advocacy, the risk communication, risk management, and the Ministry of Health, in the person of the Commissioner for Health, people were able to respond to the call to save humanity.
So even with the vaccine rollout, some people feel that the virus is a scam. If you were to advise, what would you tell them?
I will need to tell them that COVID-19 is real. No one should say there's no COVID-19. And also they should continue to wear the face mask, social distancing, and also to take care of themselves and stay safe during this pandemic, because the pandemic has not really...
It's far from over. We appreciate your time. Thank you so much, Mrs. Margaret Ayorinde, who is a nurse, certified infection prevention and control nurse from UCH Ibadan. Thank you for joining us on the program.
Thank you.
Over to River State, where the government has flagged off the rollout of the COVID vaccine in the state. At the ceremony in the Government House, Port Harcourt, Governor Nyesom Wike, represented by the Deputy Governor, Dr. Ipalibo Harry Banigo, says the discovery of vaccine is historic in the fight against the dreaded disease. The governor says the 150,000 doses that have been delivered to the state will be targeted at vaccinating frontline health workers and government functionaries.
We have diagnosed 6,813 positive COVID-19 cases, with over 90% recoveries since the pandemic started, and have performed about 132,240 PCR tests. In both waves of the pandemic, government has demonstrated sufficient commitment to keep the people of River State safe as much as humanly possible. This first phase of the vaccination is mainly for frontline healthcare workers and strategic leaders. In the coming weeks, more citizens will have the opportunity to get vaccinated. The state will support the process throughout and in ensuring that the vaccines are available and accessible.
We'll have more stories when we return in a moment. Please stay with us. Welcome back. More than a dozen countries, mostly in Europe, have suspended the use of AstraZeneca's COVID-19 vaccine over fears the shot may have caused some recipients to develop blood clots. Now let's take a look at the timeline of some total, some partial suspension. We begin March 7th, where Austria paused its use of batch of AstraZeneca shots while investigating a death from coagulation disorders and an illness from a pulmonary embolism. Estonia, Latvia, Lithuania and Luxembourg also suspended the use of the batch that was singled out by Austria. March the 11th, Romania, Iceland, Denmark, Norway, they followed. A Danish Medicines Agency said a 60-year-old Danish woman who died of a blood clot after receiving the vaccine had highly unusual symptoms. A woman had a low number of blood platelets and clots in small and large vessels. Now, March 12, Bulgaria, a 57-year-old woman died hours after receiving the shot. The DRC, Democratic Republic of Congo, cited European countries' move as one of its reasons for suspending the shot. Thailand halted indeed, with, of course, resuming much later. We'll tell you more about the countries that have resumed today. Ireland also out of an abundance of caution, and this was after reports from Norway of serious blood clotting. Now, March 15, France, Germany, Italy, Spain, Luxembourg, Cyprus, Portugal, Slovenia, Indonesia, Netherlands as well. They suspended, quoting precautionary measures. Sweden also, 10 cases of blood clots were found there. Thailand, Australia, the United Kingdom, Canada, as at today, all plan to stick with the AstraZeneca Oxford jab. Over the weekend, the company said it reviewed data from more than 17 million people vaccinated in the UK and the European Union and found 37 cases of blood clots. But it said that none of the cases was proven to have been caused by the vaccine, but investigations indeed are still ongoing. Well, to talk some more about this, joining us right now is Dr. Estienne Ukorobi. He's a GP registrar at Worcester Royal Hospital, England. He joins us via Zoom. Thank you for joining us on the program.
Thank you very much, Millicent.
All right, Doctor, it's a number of vaccine concerns, especially with the Oxford AstraZeneca dose. What do you make of the reports of blood clots?
Well, about 11 countries now in Europe have suspended the use of the Oxford AstraZeneca vaccine over the fears of blood clot. However, this has not been proven, and studies and reviews are still being undertaken as we speak to ascertain if these blood clots can be directly linked to the Oxford AstraZeneca vaccine. We've heard the European Medical Association or agency come out to say that there's been no evidence that these blood clots have been linked to the Oxford AstraZeneca vaccine. I would say that here in the United Kingdom, a total of nearly 25 million people have received the vaccine, either the Pfizer or the Oxford AstraZeneca vaccine, and there's been little to no issues with blood clots. It's also important to mention that COVID-19 in itself puts you at risk of developing a blood clot. So at the moment, I would say we should go by the guidance of the World Health Organization, and WHO themselves have advised that people keep taking the Oxford AstraZeneca vaccine. If we put this on a scale of risk and benefit, it is more beneficial to have the vaccine than to not have the vaccine. And from the reports, it shows that less than 50 people have developed these blood clots, and the reports show that millions of people have received the vaccine. An expert in Italy said that even if it were to be true that the vaccine causes blood clots, in the number of people that we have seen, that will be a rate of 0.007 per thousand, the risk of developing blood clots. So that's really small compared to the benefits and compared to the number of people that have received this vaccine without developing problems. So I would say it is important to investigate, it is important to check this out, but the benefit of receiving the vaccine still outweighs the risk.
Indeed, but the 0.001% are still people we're talking about. But let's take a look at UK's 0.28% percentage recovery, and this is while vaccinations progress. What do you make of it? Are they winning the fight against the virus?
Well, I would say that it is a step in the right direction. Generally, in the UK, a total of 4.2 million people over time have been infected with COVID-19, and about 3.5 million people have recovered from that infection, with unfortunately a death of about 125. So that gives us a total recovery of 82% with or without the vaccine. And then with the vaccine, of course, just about 0.28% recovery. I would say, as I have always said before, that we have seen from statistics, we have seen from the number of people in hospital, the number of infections daily. And just this week, we recorded the lowest number of deaths in the United Kingdom since last year. We've seen from these statistics that we're moving in the right direction. The vaccination process is working and things are looking better.
All right, that's great news coming there. Thank you so much, Dr. Essien Akurabi, GP Registrar at Worcester Royal Hospital, England. Thank you for joining us on the program.
Thank you very much.
Now, just as the European Union is preparing to present a digital green pass proposal that would admit only persons who are vaccinated into member nations, the World Health Organization is redoubling efforts aimed at ensuring everyone gets the jab.
With regard to what a certification of vaccination can allow you to do, that is at national level or international level, and the use of a certification of vaccination which allows you to travel or allows you to carry out certain activities like attend a restaurant or go to school or attend university. We have to be exceptionally careful, because right now we're dealing with a tremendously inequitous situation in the world, where the likelihood of you being offered or getting a vaccine is very much to do with the country you live in, very much to do with the level of wealth, the level of influence that you or your government has on global markets. And therefore, the Emergency Committee of WHO have made it clear in their recommendations to the Director General that at this time, at the present time, the requirement for certification of vaccination as a requirement for international travel is not justified, as vaccination is not widely enough available and is inequitably distributed throughout the world. That must follow the appropriate policies. We need vaccination policies that don't create in themselves inequity, and we need to be very, very careful that the process of certifying vaccination does not result in personal freedoms or human rights being impeded in any way that is not justified. Sumi mentioned before the risk-benefit issue here also applies. There are potential benefits from having certification of vaccination, but there are also potential downsides.
Well, let's now take a look at the global report that the EU's medicines regulator has said it remains firmly convinced that the benefits of the Oxford AstraZeneca COVID-19 jab outweighs the risks.
Global health experts are under increasing pressure to clear up questions over the safety of AstraZeneca's COVID-19 shot, as Sweden and Latvia join countries suspending their use in a further blow to Europe's vaccination rollout. A World Health Organization committee of experts is reviewing isolated cases of bleeding and blood clots in people vaccinated and is in dialogue with the European Medicines Agency. The European Union's largest members, Germany, France and Italy, suspended the use of AstraZeneca's vaccines on Monday, pending the outcome of an investigation into the reports. Despite concerns over safety, Thailand has launched an inoculation campaign with AstraZeneca's COVID-19 vaccine, with Prime Minister Prayuth Chan-o-cha first in line. He says he took the jab to boost confidence for the general public following safety concerns. Thailand had initially temporarily suspended the use of AstraZeneca vaccine on Friday. Australia also says it has no plans to halt the use of the AstraZeneca COVID-19 vaccine.
Good afternoon. Here in Australia, safety is our first priority, and in any large vaccine rollout we do expect to see unusual events, and we monitor very closely and carefully for those. But this does not mean that an event that happens after vaccination has been given is indeed due to that vaccine. So we do always take it seriously, we do investigate, but in this situation I can absolutely say that I remain confident in the AstraZeneca vaccine, that it's safe, and that there is at this point no evidence that it causes blood clots.
The NCDC is reminding Nigerians to only use accredited private laboratories for travel-related COVID-19 tests. Continue to take responsibility and take a look at our website, channelstv.com, for the latest updates on the pandemic, other stories from across the world. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.